Hi guys, thank you very much for joining the program. I made this video on today, the February 29th, 2020. This video is going to be a little bit longer than usual because we have a lot more materials and numbers to cover. The last time I made one was quite some time ago and the numbers have tremendously changed since then. As we are speaking on February the 29th, 2020, at this point, there's about 62 countries that are now have the presence of the coronavirus 2019, which do have a new name, and the total numbers now reaching over 86,000 people with nearly about 3,000 deaths worldwide. The top three countries that are the most infected now outside of the epicenter of China, including Iran, Italy, and South Korea, and the numbers are in the thousands of people infected. In the United States, as we are speaking, there's about a total of 459 cases. And a couple of hours ago, we have confirmed of 23 cases in the United States and one death, which was located in the state of Washington. From the Diamond Princess cruise ship, we brought back 44 passengers whom are also being quarantined presently. The state of California has 2 cases confirmed, and what is interesting about these 2 cases is that these 2 individuals have no history of traveling anywhere near the epicenter and have no known exposure to anybody who actually were infected with the disease. So the WHO has given a new name to the coronavirus 2019, and that is SARS-CoV-2. SARS-CoV-2. So SARS with reference to the SARS virus in 2003, coronavirus, the COV, and number 2, meaning that this virus is particularly very similar to the SARS virus. In fact, about 80% similar genetically to the SARS virus. And the virus name is SARS-CoV-2. Disease caused by the SARS-CoV-2 is COVID-19. Let's review quickly about the transmission remains respiratory droplets. We know that people cough and sneeze and spit will transmit this virus up to 9 to 12 feet. We know that the symptoms are largely remain the same: dry cough with a fever and shortness of breath that leads to respiratory distress. However, there are reports that people are getting diarrhea, and about 10% to 15% of people who are infected with SARS-CoV-2 actually reported no fever. So that is quite interesting as we observe with time and we know more about this virus. The diagnostic modalities remain the same through PCR or polymerase chain reaction. And this is a very interesting technology. The complete test is actually called reverse transcriptase PCR. And it can be used with a little sample of blood or body fluid, either respiratory droplet or the isolate from the nose and the throat. And we can run this test in the labs and look for evidence of the virus genetic material. I want to spend a moment on what we call the pathophysiology of the disease, meaning that how exactly the SARS-CoV-2 virus caused death. As I mentioned in one of the video back in January, this particular virus, the SARS-CoV-2, is 80% similar to what we had with SARS in 2003. So when you spin the genetic material down, we actually can see the similarity between the 2 viruses. And they are so similar that the outer rim of the SARS-CoV-2 virus are almost identical to the SARS virus, in meaning that it kept the protein spikes or the receptors in the outer rim. And it has an affinity for our cells in the lungs. The receptors on the cells is called the ACE2 or angiotensin converting enzyme 2 receptors. Now, why is this receptor important? Because if the virus has an affinity for that receptor, it can easily bind to that receptor just like a key and a lock. And if it's able to bind to that receptor, it's able to open the door of the cell, just like a door. You just put a key in and you open it, and you're able to enter into the house or enter into the room. And that's exactly what the SARS-CoV-2 is doing. So once the virus enters the cells, what it does next is it uses our genetic material, our genetic apparatus in the cells, used to replicate its own genetic material, its own RNA. Once it's done replicating, it will exit our cell in numerous multiplication and then infect other cells. So all you need is very few number of virus. Theoretically, you only need one virus to enter the cell and then multiply and then release outside and infect other cells in the body. Now, what happened when the virus has the affinity for the ACE2 receptor and bind to that receptor? It will cause dysregulations in that epithelial cells in the lungs. And it's very important because when that dysregulation happens is where you cause the swelling of the cells. Therefore, the swelling will lead to the fluid accumulation inside the lungs. And that in turn causes pneumonia. Now, we're not supposed to have bacteria inside the lungs. We're supposed to have bacteria somewhere in the upper respiratory tract. That's where the bacteria is supposed to live, but we're not supposed to have bacteria or viruses inside the lung tissue. So now that we have the fluid accumulate in the lungs, that will help to cause secondary bacterial infection. So it is not unusual for people to get viral pneumonia first and get bacterial pneumonia right after. So when that happens, the oxygenation of the lung tissue is now compromised. And when it is compromised, we have what we call hypoxemia, meaning that the oxygen in the blood drops because we cannot oxygenate no more. So we go into respiratory failure. But before that, we have a condition in medicine we call ARDS, or acute respiratory distress syndrome, and that can lead to respiratory failure, and that's how people die. That is how people die. You literally drown in your own fluid. You drown in your pus. You drown in your infected material inside the lungs. It is a slow death. It's a suffocating death, and I can't imagine what people go through the last moments of their lives suffering from this pneumonia. So as far as we know at this point, the mortality, the overall mortality rate related to this virus is about 2 to 3%. And compare that to the SARS in 2003, the mortality rate was about 10 to 15%, and compared it to the MERS, which was the Middle Eastern Respiratory Syndrome, which was very high, up to 30% mortality rate. The incubation period has not changed. The incubation period, according to the Center for Disease Control, remains roughly about 2 to 14 days. There are reports out there now that say the incubation period can last as long as 30 days, but that is yet to be confirmed. And there are also reports that during the period of incubation, the patient can actually transmit the virus. Largely, the treatment for COVID-19 is still supportive care. However, there's hundreds of trials ongoing right now in multiple countries, particularly in here in the United States. We are really trying to work very hard 24 hours a day to find a cure, or at least a controllable medication for this COVID-19 disease. The medication that has the most promise right now is remdesivir, which is an antiviral, and you probably heard this in the news, and it's being conducted at NIH and also in Montana facility. So remdesivir is actually an antiviral that we are using and conducting experiments on the MERS virus, and it has been successful in reducing the symptoms and severity of the MERS virus. So now it is green light to go ahead and try it on the COVID-19 disease or the SARS-CoV-2 virus. And in fact, the patients that are brought over back to the United States, repatriated back to the United States from the Diamond Princess cruise ship, actually sign up for these medications to be tested on them. So in the near future, we're going to find out how effective they are in against the SARS-CoV-2 virus versus the MERS virus. And I have received quite a few questions from audience and also patients concerning the potential vaccines and where are we on the journey of finding a vaccine for this disease. As you know, vaccinations take time. On average, a vaccine takes about 2 to 5 years to develop, on average. But because this is unprecedented pandemic, probably the worst since 1918, and that was a Spanish flu that killed probably around 100 million people back in 1918. So the efforts in creating and developing the vaccine has been unprecedented, especially here again in the United States. So I want to spend some moments discussing about what are the ramifications and the planning in the development of vaccines. Generally speaking, you have two types of vaccines. You have a live attenuated type and you have an inactivated type of vaccine. The example of the live attenuated vaccines are such as polio vaccine, for example, and the inactivated vaccines are examples such as the tetanus vaccine, for example. The difference between live and attenuated is actually in the name. Live attenuated means that basically you take a virus or a bacteria and you half kill it, mostly with heat or chemical, and you basically take away its virulence and you take away its ability to cause a disease, but it's not completely 100% dead. And what would you do is you would inject that live attenuated microorganism into the bloodstream, and that will cause an immune response from the natural host. Now, there are two types of immune response when you get an infection. The first one is called an IgM. IgM basically are antibodies or immunoglobulin, the antibodies that the body makes in the immediate of the infection. It usually rises within a couple of days to a week of the infections or of the vaccine, and it would try to fight off or kill off the germs. In this case, you basically practice the immune system to fight off the germs by giving it a half-dead microorganism. When that IgM goes away after a week or two, then you have a more memorable immunity develop, and that is what we call IgG or immunoglobulin type G. And IgG is basically the memory of the immunity to remember that organism. So if you are re-exposed or reinfected again with that bacteria or virus, your immune system will be able to fight off that infection. And IgG is supposed to last lifelong. Okay, so live attenuated, you kill off and you basically half kill the germ. Inactivated vaccine is exactly what it is. You kill it off completely. So you either inject a dead virus or a dead bacteria, or you're injecting the particles of that microorganism, either proteins or the genetic material. So in the effort in developing a vaccines for the SARS-CoV-2 virus, there are a lot of trials underway now. And what they are trying to do is actually injecting the genetic material of the SARS-CoV-2 virus into the host in hope that the body will be able to mount an immunity response against the genetic material of this virus. So it is actually an accelerated program right now, and hopefully, according to the NIH, within the next 60 days or so, we will be able to have human trials for this vaccine. So that is live attenuated vaccines versus inactive vaccines. I want to spend some moments on addressing some of the most frequently asked questions from my patients and also from the online audience. And I think these questions are worth sharing. I got asked, what can I do to minimize the risk of transmission? Which is an excellent question. The transmission of the SARS-CoV-2 virus are very similar to the regular flu, which has been largely ignored during the season and is peaking right now. And the influenza virus has killed so far 20,000 Americans and infecting hundreds of thousands of people. But it is not being discussed right now because, of course, the SARS-CoV-2 takes precedence. So the way to minimize the transmission in either flu or the SARS-CoV-2 virus is obviously frequent hand washing. And you cover your mouth or your nose when you cough, okay? Either you lift up your shirt and you cough in there or you cough into your elbow, but the best thing to do is actually cough into a piece of tissue so that you don't propagate the virus. And for the SARS-CoV-2 virus, there are evidence now that with every cough and sneeze, you can push the virus up to 9 to 12 feet. And anybody who is infected with that virus, who is not covering their mouth and they cough, can propagate the virus very rapidly and infect other people. So frequent hand washing, cover your mouth and your nose when you cough, avoid touching your respiratory tract, meaning your nose, your mouth. Can you get the SARS-CoV-2 from somebody's infected hair or beard? The answer is yes. If that infected person is coughing and has respiratory droplets on either the beard or the hair, and if you touch that and then you touch your respiratory tract, you can definitely get infected that way. Is it okay to travel now? As you know, Italy, South Korea, and Iran are now on the list of the high level by the CDC level 3. That means that the CDC recommend against traveling to those countries. And of course, the epicenter of the disease in China, absolutely, you do not travel in the vicinity of those epicenter. Also, the CDC recommend if you are going on a cruise ship that will dock or travel around Asia, you should really revise your plan because it is on the list of precaution right now. Another question is it safe to go to Chinese restaurant here in the United States? And I have audience in Canada ask me the same question. The answer is absolutely. The SARS-CoV-2 virus is not transmitted in the community in the United States right now. It is not transmitted through Chinese food. It is not transmitted through cooked food. Unfortunately, the stigma related to the SARS-CoV-2 virus has significantly damaged the economy, and we have seen the stock market has dropped because of that. In New York and San Francisco, the Chinese restaurants have experienced up to an 80 to 90% drop in business because people have fear of contracting the disease if they go to Chinese restaurant. There is absolutely no evidence of that, and it is not something that we should be fearful about because there's no evidence of transmission from Chinese restaurant whatsoever in the United States or in Canada for that matter. So there is no contraindication to go enjoy your meal, okay? Another question is, and this is quite funny, but does Corona beer have anything to do with the coronavirus? It's interesting that I read a study somewhere a couple of days ago indicating 38% of Americans would consider not drinking Corona beer during this time of COVID-19 disease. I can tell you my fridge downstairs has Corona beer in there and I love it. So it's funny, but it's not funny because that is the level of fear that people may have now, is that they somehow connect the Corona beer to the coronavirus. And obviously it has absolutely no connection whatsoever. So absolutely it is safe to drink Corona beer. The other question I get is, can I still order parcels from Asia or from China? And this is actually a very interesting and very important question that I get asked. The SARS-CoV-2 virus does not live on surfaces for long. So if somebody has it, let's say in the respiratory droplet, and they cough it on a piece of paper or boxes or table or any surface, it does not live long. And so far, there is no evidence, either by the WHO or by the Center for Disease Control. So it is safe to receive parcels from either Asia or China because the virus does not live on surfaces for long. Okay, but of course you still need to wash your hands because there's not only coronavirus that can infect you. You can get it. You can get the flu. You can get other viruses. So it's important to wash your hands if you handle those parcels coming from overseas. And the question is, can vitamin C and garlic prevent the infection of SARS-CoV-2? So the answer is no. Garlic and vitamin C will help to boost your immune system, but it does not have any scientific evidence that it will prevent you from getting the coronavirus infection. Last but not least, a very important question that I keep getting asked day in and day out, that is, should I wear a mask when I walk outside in the United States? The answer is no. So, and I have made, in the first video, I spoke about the protection that you get from the mask, either the surgical mask or the N95 mask. Actually, a lot of people don't know the difference between the two masks. So the surgical masks are the regular masks that you have the ear loop around the ear. Those masks are very commonly worn by dentists, by nurses, by doctors. You see them wear very commonly in the OR. They have a filter that can filter the particles if the particles are 5 microns and above. Okay, 5 microns and above. So the N95, okay, the 95 stands for 95% filtration rate of particles bigger than 0.3 microns. Okay, so the N95 are much tighter. That's why you have to be fitted with that mask. It comes in small, medium, and large size. So every year, workers in the hospital, I need to be fitted with that mask to make sure that it is well close on the face, so it filters the particles out. And the SARS-CoV-2 virus measure so small, it measures 100 nanometers, and that is roughly about 0.1 microns. So it is smaller than the smallest particle filtered by the N95, which is 0.3. So the masks are really not that useful. And I'll tell you when it's useful. It is useful for patients who already have the disease. So if you are infected with the COVID-19 virus and you're coughing and sneezing, you can propagate and you can transmit the droplets up to 6 to 12 feet. So if you have a barrier mask, either a surgical mask or an N95, then you stop that respiratory droplet from propagating, okay? However, if you're a healthy individual and you're standing next within 9 feet of an infected person, and that person does not wear a mask, and that person coughs in your face, and you do wear a mask, either surgical or N95, it still does not protect you against the virus from infecting your respiratory tract, because it's so tiny, it goes right through the surgical mask, and it can even go right through the N95 mask. So there is absolutely no point of wearing an N95 walking around downtown Washington, D.C. or San Francisco or New York or Chicago. So please don't do that. You don't need to do that. And it is a waste of money if you do that. We are not there, and we're not even close to there yet. Okay. Now, in the epicenter, China, they have so much infected people walking around that a mask, either you have the disease or you don't have the disease, make a difference. Okay. But not here in the United States. So I know this video is long, and I hope you find this information helpful, and thank you very much for joining me, and I'll see you soon in the next video.